to another edition of One Voice at a Time. We're glad to see that you're tuning in and getting some information that you may not have seen otherwise. As you all know, this is a program where anybody who has something to talk about, whether it's just for fun, a major issue, anything you want to share, this is a good place to do that. And my purpose is to get your voices out there, and you can watch, talk uninterrupted, and say whatever you need to say. So today, we're going to have a very interesting program about healthcare. As many of you know and are aware, there is a push in the country to reform healthcare. There's always somebody trying to reform it to make it better. And I have three very interesting people here today that want to talk to you. The first one I want to introduce is Terry. I'm going to have to be careful with all of these syllables. It's Terry Sterenberg. Did I do it? All
Got
right.
it. Yeah,
Did
that's
it.
great.
And he is the producer and also a filmmaker. And he made a movie called the Healthcare Movie, which is sort of like, now you're going to guess what it's about. and, then and with him is Laurie Simons, the easiest name on the stage today. And she is also a filmmaker and a producer and worked with Terry on the Healthcare Movie. And we have Robert McCursey?
Yep.
Okay. And Robert is a physician, and he is a family physician and is very interested in healthcare reform, as I'm sure a lot of physicians must be. So I'm really glad to have the three of you here. And Laurie, I think I'm going to start off with you. You're the rose between the two thorns, so let's start with you.
Okay.
So how did you first get involved in the healthcare reform? Because you're actually doing something. You're not just talking about it.
Oh, well, thank you. Well, I'm actually from Canada, and I was born and raised in Canada.
So you're familiar with the one
I'm very
payer.
familiar with
Okay.
the
Single
Canadian
payer.
healthcare
Yeah.
system.
Yeah.
Terry and I got married in 1982 and had 2 children in Canada. So he lived there for 10 years. And then we moved to the United States in 1992. Right before Hillary Clinton was about to try and make a transformation in the healthcare system. And so for me as a Canadian moving to the US, I was shocked. And I knew about the system, but it was just so stressful for me to live where I had to worry about money and healthcare because it never
done that
crossed my
before?
mind before.
Okay.
No dollar signs in my doctor's visits before.
Now,
And
did you get insurance through an employer, or was it necessary for you to do all of it out of pocket?
I think I had insurance through my employer, but there was a deductible
not
which
enough,
was
yeah.
very daunting.
Yes.
And I don't know if you want to tell the story about our son when he hurt his elbow, but
Yeah,
You're doing
absolutely.
good. Go for
Yeah.
it. You're doing good.
okay. Well, at any rate, when we realized, it was going to cost us a couple of $100s, or we didn't know how much it would cost and did he need stitches, and was it still bleeding after an hour and a half?
Right.
It was very difficult for me as a Canadian living in the U.S. to feel like I had any kind of voice. And so then in 2009, when we started to hear the subject coming up again, by then I had studied filmmaking, which is a second career. We'll tell you about the first one later on.
Okay.
And some friends of ours, we were having dinner together and talking about the healthcare issue. And actually, I think it was Terry said, somebody should make a film about the Canadian healthcare system for the American audience, because it doesn't seem like they understand it very well.
Isn't it interesting? You have
lot
to be
of myths.
careful what you say, right? Because the next thing you know, it's all
That's
on
right.
you.
That's
Yeah.
right. And so
Well,
we
the host there
did.
said, yeah, why don't you do it?
Yeah.
Yeah,
I've heard that a lot.
that's how that got
Okay.
started.
Now, I want Laurie to talk a little bit, and then we'll go to Robert. So
Yeah.
now, how
Well, I
did
can
you
tell
get
that
into
story
all
that
this?
she's
Same
talking
thing?
about,
Okay.
because one of the things that really made us really aware of the system was having to deal with it. And one day our son came home having fallen down and scraped his elbow.
Yeah.
It looked like a relatively minor.
Did I tell you these two
Scrape.
people are married? Just, we have
We
to
are
reveal
married.
all of
I
this.
am an
Okay.
American, by the way. I'm not a Canadian, so we kind of.
Do not break out in song.
I won't do that. No, you can guarantee it. I won't do that. But anyway, one day our son came home having fallen down skating. And after, like Lori said, Lori came home an hour and a half later. I kind of looked after him a little bit. I don't know. She came home from work an hour and a half later and it was still bleeding, and she was really, really concerned about it. And it was really it was a wake-up call for me, because I was really, the first thoughts that came into our heads was, can we, if we take him to the emergency room, can we afford it? What about our deductible? I mean, all these thoughts went through our head, and this was our son who was in pain.
Yeah.
And so that was that was kind of a wake-up call for us about,
You shouldn't have
we
to
shouldn't
have
have to,
that.
nobody
Yeah,
should
yeah,
have to
yeah,
have
yeah.
those kind of thoughts
Yeah.
when you need to go to the hospital. That's the bottom line. If we were in Canada, there wouldn't even have been that conversation.
Yeah.
And Robert, how did you get involved?
So I went to medical school in Chicago, grew up in Chicago on the south side of Chicago. My parents were very active in the civil rights movement, and so I've kind of always had a social progressive,
Come from a family of activists.
yeah, social progressive angle. And when I was in Chicago, I was luckily mentored by Dr. Quentin Young, who is part of PNHP, which is Physician for National Health Program, which is the national driving force behind single payer. So I got to work with Quentin very closely with single payer, and I debated a lot and talked a lot on it. So it was a nice fit. It was like I really believe in every aspect of single payer and what it can bring to this country. Presently, I'm a family physician. I work in Lawrence, Mass. At a federally qualified health center. In fact, I've always worked at federally qualified health centers. And I do the full gamut of family medicine, everything from delivering babies to working with the elderly.
Wow.
Enjoy it very much.
Why do you look at me?
But to what you had mentioned about getting your son into care and the worries you had about spending and could you afford it, I see that every day where I am. And even though we're in Massachusetts and we're under, I guess you
Mass
originally
Health.
call it Mass Health, or Romney Care, which is now kind of Obamacare. Even though we do, most people, probably 95% of Massachusetts are covered, there are still major gaps in those. I have patients every day who are, choosing between paying for their medicines or putting, bread and food on the table. So it's a real concern among people to be able to pay for their medical bills. And we know nationally that 2/3 of bankruptcies are medical related from the bills. So the system needs to be reformed.
And these are people with insurance.
Absolutely.
And so
These are people with insurance.
having insurance doesn't necessarily protect you from
No.
this worry.
No, I
doesn't at all.
remember going online and looking for insurance companies right after I retired, wondering if I could do better than what I was doing through my retirement. And it was those, give me a hint.
Premiums.
That's
and,
it. The deductibles, it was just so high that there was no way.
Yeah.
And like if I had to pay my own way, the last time I looked at my list of medications, it was over $22,000 a year. It's gone up considerably since then. And I know that that's definitely an issue for a lot of people. I mean, getting a deductible of $1,000 might not seem horrible to some people, but to other ones, it's the decision to not get the care.
Yeah.
But I think one of the things we need to get into is to explain to people what the single payer system does. How does that work? Because I'm sure that there's so many people who have only heard that phrase from Bernie Sanders. That's right, Bernie Sanders, yeah.
Right.
And they want to know, what does it mean? They need to know, what does it mean? Because otherwise, how can they react properly to the term? They need the information behind it.
And I didn't know what it meant when I came from Canada.
Because you didn't
Even
need to
though
know.
everybody says that Canada has that kind of a system. In fact, Canadians I know, they don't know what that means. But I think it's
Who made that up?
It's a term, we're also both counselors, so providers. We provide mental health counseling.
Oh, okay.
And so we've been in that other end of, billing. And when you're billing for your patients, and I'm sure you come across this too, you have to look up, well, which insurance do they have, and of that insurance, which plan do they have, and what does that plan cover, and how many sessions does it cover, or how much of does it cover, or is it a percentage, or is there a deductible, or do I have to collect a copay? Every time you see a patient, and there's
You have to know
multiple insurance companies, multiple insurance plans. I think I counted 38 that I was dealing with at one point. It was just ridiculous, and paperwork up to here.
Yeah.
And so from the point of view of a provider, single payer is very much of a relief, because all it means is I'm only billing one source. And it's easy to understand because everybody's kind of got the same coverage and I don't have to look it up.
Right. The layers and the layer of bureaucracy under our present system is just daunting.
Yeah.
And we have reams of people we hire in this country and are employed just to get through the billing.
Yeah.
I mean, the numbers, you guys know the numbers, they think potentially up to 30% of healthcare dollars right now are spent on just administrative that we could save.
Yeah.
So yeah, it's very real. It's a very,
Yeah,
in
and
fact, I've
that's-
never met someone from Canada who would trade their system for our system. Every
We have that
person
in the
from
movie.
Canada always says, their system is great, and it is. It covers you cradle to grave, all expenses paid, and you have better outcomes in the United States, right? So,
Well,
in
the
every area. I mean, not just,
Yeah.
know,
The other
yeah,
thing that I'm asking myself here is, the single payer is paying to who? Who's that person that are government entity that you pay to?
so it's
If you're a single
government
payer,
financed,
government
right?
financed, okay.
But for the most part, privately administered.
Oh, okay.
So the government
All right.
won't own hospitals. They won't own clinics. There will be government doctors that work for the government, for the VA. That's an example. But for the most part, it's just going to be government financed, and it's going to be or quasi-government financial system where the monies are going to come from the government, and they're going to get those monies right now if the system, if single payer passes and goes forward through already what we're spending on Medicare and Medicaid, and then minor taxes. And for the most part, the tax that you're going to be paying for this system, for most individuals, is going to be less than they're paying right now. I think it's like 2% of your income tax would go towards helping pay for the single payer, and that's actually less than I pay right now in my health care. And most small businesses, and you guys can speak to this, will pay less, no more than maybe 7%, I think, and they're probably paying more than payroll tax now, more 8 to 9%. So there'll be savings for 95% of people in this country,
Wow.
and never worry about a premium, which you talked about.
Yeah.
Co-pays, cradle to grave coverage. And all drugs will be covered, So it makes infinite sense, right? So why aren't we there yet? And we
I
know
don't
why
know.
we're
I
not.
know the
like,
whole system
like
is just so
taxes
messed up.
is one of those trigger monster words.
Right. Oh, did I
you
say
know?
taxes?
No, no, I said taxes.
No, he
Oh, I
did.
did say taxes.
you
so.
But the truth is that about this is that you actually end up by not
Paying
paying
less.
deductibles and co-pays and all that you mentioned, you pay less.
Absolutely.
In your tax will, as Bernie Sanders says, the tax will go up a little bit if his plan goes through. But the ultimate bottom line is you end up paying less, and I
Yeah.
think that's the important thing that is really hard for people to grasp when they say taxes go up. That's all
Well,
they hear.
And I think,
it's one
for,
of those.
I'll talk about the old people. I think that a lot of elderly are expecting, they're not elderly when they retire, but they're expecting that they're going to retire and have Medicare for their health coverage, and they're not going to have to worry.
Yeah,
But then when you get there, like for myself, in order to get good coverage, I had to get private insurance on top of my Medicare. And that ends up taking about 75% of my Social Security check a month to pay that.
75%.
75%.
Wow.
And now I can, I mean, they're great as far as like with the deductibles and things like that. I usually meet my deductibles in a month, but I showed you how much my prescriptions were 5 years ago. That was the total. So that's why I'm able to get that. But it's shocking to find out that it's still going to cost you money.
Yeah.
I'm only paying like $200 less than I did before I got Medicare on the insurance. That's all I saved, $200.
Those costs, coming back to the costs and the burden on the families is just immense. And I work in the ICU occasionally at the hospital and in end-of-life issues.
Oh,
The
yeah.
last thing you need to be worrying about as a family, caring for your loved one near the end of their life is, can I even afford the bills that are coming to me? That is a burden
Yeah,
that we do
it is.
not need to be giving people.
It is, yeah.
So,
Yeah, one of the reasons why I wanted to make the movie that we made, the healthcare movie, and was because it was very difficult for me to explain what it's like to live in a different environment to
yeah.
somebody who was American. And first of all, what we heard was, oh, you don't want a system like Canada because they have to wait, and because it's socialist, and because they had all these reasons,
rumors.
which would be a conversation stopper. And so people weren't really even asking about it.
See, perfect place.
And-
you get to say whatever you want to say, and they ought to be listening.
There you go. But what was really hard to describe, you know, we can talk figures and we can talk taxes, but from a personal perspective, I paid my taxes. It was taken out of my paycheck, and the money that my take-home pay, the money that I took home to put in the bank, never saw a medical bill. I never had to take anything medical out of my take-home pay. So I paid my taxes, and then everything was looked after for me. So there's a tax rate. We all pay taxes. There's a particular rate. Some people think it's higher in Canada. Maybe it is a little. I don't know. I don't think it's that much different. But I never paid a premium. I never had to pay a doctor. I could, if I hurt my foot, I could go down to a clinic and get an X-ray. No questions asked. I just show them my provincial card. And then the clinic just takes the card and they send the bill to the province. And it's so simple, it's almost ridiculous.
And the wait times, that's been very interesting, because the wait times in Canada are not longer for, you know, medically necessary
But that is one of the things
procedures.
that people talk about, like you have
And-
to wait in line to get
Well, you
a
have-
medical procedure that
But-
could kill you.
But you have to wait here. If you don't have the money in this country, you have to wait. I have patients that cannot get a hip replaced because they don't have the money and the proper insurance. In Canada, you may have to wait a couple months. I'm understanding if you have you need a hip replacement, but it gets done. It does get done.
Doesn't cost you anything.
And it doesn't cost you anything.
And, you know, Canadians don't mind that. Maybe it's, I don't know, they're more polite or something, but it's kind of like, no, you have a bigger need than me. You go first. You know, I can wait, because I know that the attitude that we were trying to portray in the healthcare movie is that if we think of other people as, you know, if you need help and we make sure you get help, then when I need help, you'll make sure I get help.
Yeah.
And it's a much more secure feeling instead of that feeling of I got to pay for mine and you got to pay for yours.
Sounds wonderfully old-fashioned.
Does it?
Love it.
Well, it's interesting. We had an experience of going to visit Laurie's aunt in Toronto at one point, and we showed her the healthcare movie. And after showing it to her, I said to her, "Well, what would you like us to make sure that the American people know about the Canadian healthcare system?" And she said the one thing out of the movie just in general, that she really wanted to let people know was that it is really true that Canadians have this attitude and feeling that they want to care for each other. That's absolutely true. We didn't go around and pick those people out and put them in the movie.
Right, yeah,
You know,
yeah.
that she just and she was very that was a very heartfelt thing for her. You know. Because she feels like Canada's been so misrepresented in the United States that's what she said. And I was a little surprised, a little bit, but not much, because I know her. But
Yeah.
Well, I know I've got some relatives in Nova Scotia. You still count that as part of Canada, right? Yeah. Okay.
You have an annex that.
I have several family members up there, and I know that whatever they have needed for help has come forth, and they've been well taken care of, and I think that's really, really great, especially some of them are older.
Yeah.
So,
What has been your response to your movie when you've shown it? And what have
Where
the
have you
audiences?
shown it?
Yeah, where have you shown it?
it's been shown all over. You know, it came out in 2011.
Okay.
2011. And the first time we showed it was in Canada, believe it or not. We were living there, and so we showed it. Got a standing ovation. We were very surprised. We had like 120 people there.
yeah.
And so that was kind of our first experience with it. But then it's been showed all over. PNHP, Physicians for a National Health Program, have really, many of the chapters have just kind of embraced it as their movie of choice.
That's
Right.
great.
And so.
I hope you're heavily using Access Television to get it out
Well,
there too.
it could be used more. That's
Okay.
for definitely sure. And I hear that it's not that hard,
Nope, it's not.
so people should do that. They should use it.
Yeah, you basically have two big options for that, is that it goes all over the country to all the public access channels, and then you have the second one that goes all over the state here. And that's going to happen automatically with this when we're done. It'll go to everybody in the state that has an access center. And we can talk about how you get it out there nationally through the same process.
So we've given permission for Vermont, New Hampshire, and Massachusetts to show it on their cable
Yeah,
access.
good.
And just to complete the answer to your question, the advocates took on showing it in their communities. So it's been shown in
Good.
theaters, local theaters, libraries,
Right.
community centers, churches and synagogues and places of worship
Fantastic. Yeah.
throughout the country. We've
Yeah.
been on 3 tours with the movie, an East Coast tour, a West Coast tour, and a Southern tour through Georgia and the Carolinas.
What
And
kind of
so-
feedback have you gotten from these different places?
Well, the advocates obviously really,
Right.
really enjoyed it and really like it and think it's very useful.
So they must feel
there's
they're
been
getting good
only,
positive
it's been overwhelmingly positive, 99% positive. You know, it's like, I don't know, do you want to?
Well, it tells the story of what happened in Canada that led to the healthcare system there, and it reveals the fact that in about 1950, when I was a little girl, the systems in Canada and the U.S. were almost identical. And so it hasn't been that long that we've now evolved these 2 completely different healthcare systems from the same source, and I've witnessed that in my lifetime. So the movie tells the story of how that happened in Canada and why it didn't happen in the United States. And so it's very eye-opening. It was for us when we made the film. And I think that's what happens when people watch it, is they go, wow, I didn't know that it's been since 1948 that we have been told that a system like what Canada has is socialist, and we better not want that. And it was actually part of a public relations campaign that was paid for
Designed.
and designed specifically to dissuade the population from wanting national health care. And the language that was put into those ads back in 1948, word for word, was coming back in 1993 and in 2009. Word for word, and that some words could last that long in the lingo,
Yeah.
and it would just prevent people from even having a discussion about it.
Right.
You know, you mentioned that moment when Canada went towards a single-payer system, and there's a great graph, I think PNHP has it, where they show infant mortality. And that is the demarcation where Canada was above in terms of infant mortality the United States, and then it slowly went down, equaled, and then was under the United States. So it can show you the power of a a public system like that that can really have an effect on
There's a
I
graph
would
like that in the
imagine-
movie, too. Yeah, I'm sorry. Go
No,
ahead.
no, that's okay. I was going to say, and I imagine that some of that might just be because those other children that are dying here compared to how many are dying in Canada would be that they may have moms who can't get
Access.
health care at all. The prenatal
Right.
health care, the, you know,
Yeah. Number one reason
that's important.
pregnant patients who know they're pregnant don't get health care in this country is because they don't have access to health care.
Yeah.
And when you have a system like they have in Canada where you can get access to health care, then it's preventive medicine. You're
I-
gonna,
I think the thing that we didn't say about single payer is that it also refers to the fact that everybody has access to
Right.
health care. It's a universal health care system. And some people think that the ACA is supposed to be universal, and it absolutely isn't.
Right.
And, you know, there's still, how many? I
30
don't know,
million.
Yeah, there's about
I
30
think
million.
about 30
that
million
don't-
by
aren't covered.
2020 will.
ACA,
The
Obamacare.
Affordable Care Act, the
Yeah.
Obamacare, yeah.
Yeah,
It's
it's not
actually
going to
for-
cover everyone. It's going to cover probably close to
It's not even
90
designed to.
Yeah.
It's not, you know.
95% of Americans where a single payer would cover 100%, and
Yeah.
5% of how many? 240 million? That's about.
And what we've discovered is that it's actually cheaper to do that. It costs less for health care when you cover everyone,
Oh,
which sounds
absolutely.
kind of a cognitive dissonant when you think about it, but it's actually true, and that's why all these other countries in the world, it's so
well,
much cheaper.
For one thing, it always costs more to fix a problem that hadn't been treated all along. I
Preventive
would think.
medicine saves
Yeah.
money. Yep.
Yeah. And then we're also saving those administrative costs
Right.
that we're having to pay out right
Right.
now.
Right.
So
That's huge.
Yeah.
It's like
Oh, yeah.
20% of our costs.
I think the mindset
20
that
to
they have in
30%.
Canada, to get back to, you said the mindset of you care for your neighbor, that collectivism. I mean, I think we have that in this country in certain
I do too.
areas. I mean, obviously, Faith-based organizations have it, community-based organizations, and
And
even secular.
it is still there. There are still churches and people that do that.
But in terms of our mindset, in terms of healthcare, we're not there yet. In terms of we're all in this together. We need one big, insurance pool, and I have to take care of my, my brother and my sister as well as, my neighbor.
And I would think for the people, one of the key things would be that they're not writing a check, they're not paying for insurance, that whatever their coverage costs them that day, they're not paying anything. It's going to be the government that takes care of it. And I don't think that's something that people know. Single payer, you sometimes cringe and think, me? I'm going to have to pay that by myself now?
Right.
So no,
Yeah.
that's not the case at all. That's not why it's a single payer system. Do you find that Mass Health is starting to address this issue?
Well, Mass Health has been in place since Romney, when he was governor, put it into place.
Yeah.
And we still have gaps, and Obamacare is modeled very much on Mass Health. So, we have 95% of people covered, but 5% of Massachusetts aren't covered, and then we have a lot of patients that come through our federally qualified health center that I can't get the medication I want. I get denied a CT or an MRI on that patient, then I have to go and do extra paperwork. So it's
I
not
love it that you're the doctor and some vague panel out there that we
Bean-
don't
we
even
call
know
'em-
about are making those
call 'em
decisions.
bean counters.
Bean counters, okay.
So it's a frustrating entity. I've never worked in a system like Canada or Great Britain.
Don't you want to leave right now?
Well, you mentioned an interesting point, because
I did.
one of the arguments against single payer, and it was a fallacious one, is that more Canadian doctors are coming here to work. Well, that's not true. There's actually more doctors going from the United States up into Canada to work because it's easier to work. You have less of a headache. The salaries aren't less. Certainly, if you're a super specialist surgeon, you'll probably make less in Canada. But as a primary care doctor up there, they're doing quite well. So a lot of the arguments that have been thrown to disparage single payer are very easily disputed if you have a chance to sit and talk about it,
yeah,
and people
yeah,
can
yeah.
think about it.
I hate to say this, but I think it's true. Isn't it that the entities that are collecting money from us now are afraid that they are going to lose money? So there wouldn't be, if you take out all the administration costs at all the various offices around the country, they want to know where are they going to work.
So you're talking
Okay.
about
I'm just starting like from the
Right.
insurance company
Sure.
down.
So
okay?
there's what do we predict? Maybe, or the numbers are about 30% of monies we could save on overhead, and those are people that are in insurance companies that are there to review the doctor's orders and deny them or accept them, and so there's this huge layer of bureaucracy that
Right.
will have to be untangled, and those are real lives. Those are people who have jobs. A lot of those people have been trained already in healthcare. A lot of them are nurses or mid-levels that have decided to have another angle on healthcare. They're going to have to be either retooled or to find positions back in the healthcare system that's now going to cover more people. We're going to need more providers. And I think it's very fair to say that has to be done carefully and well, and people shouldn't just be given a pink slip and shown the door. And I don't think that's going to happen. I think there's enough monies in the system when we're spending $3 trillion a year on healthcare, almost 20% of our economy.
That is.
Yeah. There's monies in there to make the system right and to keep these people working.
But there are
there's
other-
actually a provision in the National Healthcare Bill, which is H6,
HR.
HR
676,
676, which provides for retraining
Right.
as well. So there's money for that provided in the healthcare bill.
Do you think it's going to affect the, the profit margins for the insurance companies, for the pharmacies, all of that?
So the insurance
Because
companies,
those can be pretty big lobbies.
well, they are very big lobbies, and the insurance companies would be taken away.
Okay,
And
so they
that
would be dead set against
They
this.
would be
Yes.
gone. Yeah,
They
they are.
would be gone, okay.
And the pharmaceutical companies, right, well, through a single payer system like they do in Canada, where and even our VA system, which is kind of almost a single payer system, they are able to negotiate big discounts for medicines, I think up to about 40% less on their medicines. So the profit range for these drug companies isn't going to be as large. That doesn't mean they're not going to be able to do research.
No, they're still going to have
A lot of
to
money
work
for
with, yeah.
research already comes through the National Institute of Health, and that's government money, that's taxpayer money, that's my money going
Okay.
towards the government that then funds this research for drugs. So they're going to do fine, but there won't be any private health insurance, you're right.
So it's
Yeah.
tough on them. You mentioned taxes again, and
That word.
because I think that's one of the things that scares people.
It
Right.
does.
Yeah,
And I want to point out something that I learned recently, the figure, 64% of the medical care that's currently delivered throughout the United States is paid for by us
Right.
already through our taxes.
this is really-
The veterans,
That's-
Medicaid, Medicare, and the subsidies now that if you get your health insurance through the exchanges and you're in a particular income bracket, you get a subsidy to help pay for your premiums. So the government is actually paying the private insurance companies to provide this sporadic care for us.
Right.
And also, I don't know who pays for all the people. I talked to 4 people last week just because they were having trouble getting my primary care provider listed on my plan, or I was having trouble. And I'm talking to 4 people, hours of time that is wasted. My time is wasted, their time is wasted. But if we took the 64% of taxes that we're already paying and supplemented that a little bit, we could cover everybody through our taxes. And it really, for an individual family, it would cost $5,000 a year less. Because even though you may pay a little more in income tax if you have a certain income,
Yeah, your out-of-pocket is going to be,
you would not have any premiums. And right now, the average American family is paying, how much is it, $12,000 a
Yeah,
year
it's at least
for
12,
premiums?
yeah.
And then that doesn't even cover everything. So on top of that, you've got to pay your deductibles and your bills, and the bills keep coming in. So
And even for small businesses, this is a nice positive because they're
and
going
for
to
that
pay.
reason,
they're
because
gonna
they
pay
have to
less
have somebody
on
doing
their payroll
that.
taxes.
Yeah, a lot
Yeah.
less.
Yeah.
So that's important. It's interesting. So you're right. 64 to 65% of healthcare dollars now are already coming from taxpayers,
Yeah.
and we spend twice as much per capita in this country than any other country in the world on healthcare. So our government, taxpayers, funded, is already paying enough compared to other countries to cover everyone in this country.
Yeah.
If you go to a single-payer system, we're not going to spend less. We're going to still spend $3 trillion a year. So it's going to be Canada supercharged or turbocharged because we're going to have these extra monies. And that's going to allow us to do other things that Canada probably doesn't do now. I don't know if you get drugs covered there
No,
or what.
no, they don't.
So, I mean, there is
So
some
there's no drug
out-of-pockets in
coverage?
Canada
We'll
that you
come
will
back.
not have.
Oh, yeah, we got to
We'll
come
come
back
back
to
to
that.
that.
here.
Yeah.
But so and that's another thing. Everyone thinks we're going to decrease the amount we're spending on healthcare. No, we're going to reallocate it and allow it to cover everyone from cradle to grave. So,
I just
go ahead.
I just want to re-emphasize, I think they've each said it, but I want to re-emphasize again this whole thing about the 64% because it's 64% of all, I just want to make sure this is so clear, 64% of health care provided in the United States is already being paid by taxes
all right.
by the government. So it's the other, what is that, 36?
36.
That is in the insurance business. The insurance companies are servicing the rest of us, and that's where we're paying for everyone else, basically.
You'd almost call it corporate welfare.
Yeah.
Right? We're siphoning off a lot of important, valuable dollars that could be going to healthcare, keeping people healthy, into a private, for-profit
We're
system.
subsidizing the insurance companies.
Yeah,
We're-
here's
we're the ones
another-
that are keeping them in business.
Another example of what makes me mad is that the money that we pay in our premiums, it goes to 15 to 20% of administration, and what that pays for is in Portland, Oregon, for the MODA, the health insurance company there, put their name on the stadium. $8 million of our money that we
To
pay
put a
in
name on the
premiums.
No, it's
stadium?
more than that. It was like 40 million.
40 million, 8 million a year for, it was 40 million.
It was
and it was our
amazing
money,
amount of money.
that we're paying in premiums to put a name on a stadium. And the other thing that our
It
money
takes your
goes
breath
to,
away.
This is
believe
just
it or
one
not,
company. I mean, this is all over the country
is-
where
Yeah.
this is happening.
it goes to the people who play with language to make us think that the insurance companies care about us. And so you'll see the ads for the insurance companies, and they're saying, you know, join our family, we care about you. And they actually hire researchers to look out, with our money that we've paid them, to find words that will make us think that we should buy insurance.
Yeah,
And
you
so
guys should do another
marketing.
video like
Yeah, it's
that.
all marketing.
we
the
are
other
doing
side of that.
another film.
Yeah.
actually.
No, I'm just talking like if they're going to do spots on TV, maybe you guys should have one too.
Well, we don't have the kind of money they have because they have all this money to pay to get their spots on
Yeah.
TV.
Yeah.
So what the public is seeing is what's paid for by these insurance
Yeah.
companies who
Corporate.
cherry
Yeah.
pick the healthiest people to cover because they're not in that 64% that we
Yeah.
cover,
Yeah.
Medicaid, Medicare, the vets, and so
Yeah.
on. We cover all the people with the high health care needs.
Yeah.
They're covering the healthy people and taking
Because
a
I
big
wasn't
profit.
looking at it from that perspective, but when I see the ads on TV about different medicines that are out there now,
Yeah.
Yeah.
that
Yes, yes,
aggravates me. I
that's-
don't think about them paying.
Well, that's direct to consumer
Exactly, but
marketing,
that
which
makes me angry
is-
because I don't think that's right. I
lot
think
of-
it's led consumers to demand from their doctors that they get things that they don't need.
That happens a lot.
Yeah,
You get a
so-
patient that comes in and says, hey, doc, I saw this on
Yeah. Mm-hmm.
TV. And so is it right for a drug company who's, you know, probably one of their primary interests is their stockholders and their
Mm-hmm. Yeah.
and their own bottom line
Yeah.
to be going directly to the patient with information that really the doctor and the patient should be talking about?
However, they do have the disclaimer that it could cause this,
Yeah.
this,
Right.
this, and maybe death.
Right. Well, they have to, right?
I always laugh at that.
I-
You know, it's like you
Now
know,
I really want it,
buy
right?
this medication, but then this will happen to you.
Yeah.
You know, it's like, oh
So do
my
I want
God.
to trade off this for those 20 side effects? Probably
my
not.
gosh.
Yeah, it's hard.
Crazy.
Yeah.
It is hard.
I just wanted to come back to the subject of what happens in Canada with the pharmaceuticals, because
Yes.
when they got the healthcare system in Canada, they actually admit that they made a little bit of a mistake because they did not include two very important things: dentistry and pharmaceuticals. And they did that because they thought, well, we'll get that later. They thought
And
we'll
they
take
never
a
went back to
part
do
of
it
it,
later?
and they just have never been able to go back and get that. So what happens is that the pharmaceuticals are they're not allowed to sell insurance policies for medical care or for hospital care, but they are allowed to sell an insurance policy for pharmaceuticals. And so Canadians buy this little supplemental plan, which is, I don't know, $40 a month or something. And what that does is it covers all their medication. They pay maybe a small copay for that. But because it's all across the country, the negotiation for the charges on the pharmaceuticals are way less.
Yeah.
So,
So you have the buying power. Yeah.
Yeah.
Important. And that's what the VA, we mentioned that before, that's what the VA has. They have a buying power so they can get their drugs cheaper and then pass them along. at a
This
cheaper
is
price.
sort of a little bit off track here, but you've mentioned VA a couple of times. And I just had this idea driving home the other day. They were talking about healthcare on NPR and how much it costs and all of that. And then the next program was talking about something to do with veterans. And I just went, wait a minute. One of the major complaints from veterans has always been that the ones who aren't near a hospital, the VA hospital, and they've got to drive 6 hours to find one. Why don't we put the two together?
Well, single payer will do that.
And so we take,
Right. You-
the VA and the hospital, and now they're one entity. You don't have to keep up that building. You do better over on this building.
Yeah, I mean, that's what I mean. In Canada, you can
Well-
choose your provider, right?
Yeah.
And that would be the same
Exactly.
single payer. And
you can choose them, and you can get 3 or 4 opinions.
Yeah.
You know, I mean, like, you can go anywhere you want in the
Yeah.
whole country, where you can't do that in the U.S. because
And
of your
at
insurance
present,
policies.
I do have patients who are vets, and they'll come to me for certain things, and then they're savvy consumers, and then they'll go to the VA when they have to have certain things done, because they can get them done there free, or they'll come to me if they don't want to have to travel to the VA hospital, or if there's a line there that they.
Yeah.
So they. But that would, to your question, we would have one system, and the vets would be part of our system.
In any place that it made sense, maybe
Yeah.
we could do some mergers and save some extra money.
And then you think about the vets that are coming back from our recent wars. I mean, in the stories of them not being able to get health care and not being able to get mental health, and it sounds like you folks are in mental health,
Yeah.
Yeah.
that would all be available to them.
That's
Yeah.
amazing.
So,
I think we need that.
absolutely.
Yeah.
So now we're all nodding our heads. So we're thinking of what are we going to say next? Have we really covered this pretty well? Are there
Well,
some other
I'd like to
things that
say
we
something
should?
about the business.
End of things?
The business things again. There's a great movie that just came out called Fix It, which is really
Yes.
addresses the whole business aspect, small businesses. It's addressed toward small businesses, and so I would just recommend that movie. It's going to be shown.
It's
I guess it's on
being-
Access, isn't it?
Yeah, it's on Access in New Hampshire. We have a central server situation where they can put one thing up there and all of us have access to it.
Yeah,
And it's
okay.
been playing here for, I think, 2 weeks now, 1 or 2 weeks.
Along with the healthcare movie.
Yeah,
No,
yeah.
I-
Now, go ahead.
Oh, I was going to say regarding business, I think one thing many people are not aware of is that in Canada, your medical care is not tied into your employer at
So
all.
it's not a benefit.
The
It's
employers
you
don't
get
provide it.
Yeah,
You
yeah.
get it already from the
Don't
government.
they call that entitlement? Like entitlement's a
Yeah.
dirty word.
But which means that you don't
You-
have to
no,
get
I-
stuck in a job
Yeah.
that you don't like
Yeah.
or
That's
a
that's
very
And
that
you
good
don't
point.
have to
outgrown.
worry about, aren't we looking at legislation right now that will allow people to take their insurance with them
We
when
can
they
do
go?
that through what's called COBRA. You
Well, we
can-
have
but
COBRA,
that's
this is
expensive.
something-
Right, it's
yeah,
very
this
expensive.
is
but
something else they were talking about.
you bring up an excellent point. There are
Yeah.
many people who stay in a job that's probably not right for them. They
I
can't
can think
advance
of a few
because
friends right off the top of my head that are in
they
that
don't want to lose their health
situation.
insurance.
Which
and
actually
it's
must contribute to the mental health being a problem. If you're in a job that you hate, I never could understand how somebody can get up every morning and go to a job they hate because they can't quit because of benefits. And
And this is a huge savings. A single payer would be a huge savings for small businesses in this
Yeah.
country because they wouldn't be paying those premiums anymore. And it's amazing when you think about it that businesses just don't embrace single payer tremendously
Well,
because it
there's
would save
obviously
them a
not-
lot of money.
Yeah.
enough. It's so frustrating sometimes how long it takes to get something done. But you keep saying single payer, single payer. Don't say it 10 times fast. I can't.
Yeah,
But you
yeah.
say it over and over again everywhere you go, and eventually people go, "Oh yeah," and then after that they want it.
The
They
other
really
term
need
that
to. It has to
They
be
can-
familiar
the
to
other
them.
term that they're using, and I think that maybe can grab people a little more, is Medicare for all.
Yeah, Medicare for all.
Because there's not many people in Medicare do not like Medicare. I mean, there are a lot of people who are in Medicare who like Medicare, and so it would be
Depends on-
Medicare for all and
Yeah, I think it depends on
supercharged.
their health situation whether they like it or they don't like
There's
it.
co-pays, you're right.
If there's just a regular, everyday kind of health issue going on, no problem whatsoever. But if you're a little bit outside that norm, get refused. You have to send more verification that you really do have this condition. And it always frustrates me. I'm like, I'm getting personal here, but I have an insulin pump. And my Medicare kicked in December. I needed supplies in January. The insulin was no problem. They were sending me that every month. I couldn't get supplies. Nobody would give them to me because Medicare doesn't cover it. Like, I'm sorry, but they have to. They're not the doctors.
Yeah.
And you're going to let me have insulin, but you're giving me no way to get it into my pump and into my body. That's crazy. It took about 4 months for me to finally, one company that was saying, we can't do it and Medicare won't cover it. I was like 0.1 off on some test that they did. So I said, you know what? If you don't submit a bill, I can't appeal. Send me the document that lets me choose which payment I'm going to do. So the poor guy was like, I have no idea what you're talking about. I said, well, then go to your boss or your manager or something because this is a document. I've seen it before. He went, called me back. He said, I want to thank you. I learned something new today. So he sent me the form and I filled it out that Medicare, I want Medicare to pay this. If they don't pay it, I'll pay it out of pocket. It was a big promise. But eventually, after all of those months of frustration, I ended up getting the supplies.
Yeah.
But nobody notified me that now I was being approved. I just got a call from somebody saying that they were going to be sending my new shipment. Did I need anything extra? And I'm like, the first thing I need you to do is check and see how much I owe you now. No, nothing. I owed them nothing.
Wow.
That copay in Medicare would obviously would disappear under single payer. But,
Yeah,
Yeah.
yeah.
Yeah, that
Yeah,
would
I
be
mean,
good.
that's why we call it Medicare for all, but it's actually improved Medicare for all because all those things you're talking about would be covered in the
Yeah.
in the bill. In
Yeah.
the,
It's hard to know how people are taking the terms and what they're really thinking
Well,
about.
We have to
that's,
be
that's
very
how you
careful.
frame. It's how you frame
Yeah.
it, right?
have
It's,
to be really
maybe,
careful.
maybe the
Yeah.
doctor can explain something to me. I'm going to take advantage of you. How is it possible for your health insurance to only charge you $1 for 3 months worth of drugs?
So I guess it depends who your health insurance is and what kind of, I mean,
Well, we're
like for
talking-
instance, Walmart, they can give steep discounts because
Yeah, but no.
they move so
Yeah.
many drugs that they can pass that on to the patient.
Yeah, as part of my insurance that I pay for out of pocket, which is through Anthem, I only have to pay $1, and
Per-
I pay a little extra for that coverage.
And so that's $1 per
One-
medicine per month, is that
No,
right?
for 3 months.
For 3 months?
Yeah, even my medication that costs
Well-
like thousands of dollars a month.
Yeah.
It's
Well,
only
they-
$1.
I'm not a businessman and I'm not an economist, but they're not giving away money. Anthem
that's
is a
what-
very
yeah.
profitable for-profit healthcare healthcare insurer, so they're taking it from somewhere else, and I don't know where.
And that's
So-
the thing. I don't know where
I mean, it's
either.
nice just getting passed on to you, but they're.
I mean, the dollar seems silly. It's like a token. So it
Yeah.
makes me think that they could, if they wanted to, give me this for free, but I don't know who's paying for it, and obviously someone is paying for it. Just always, I'm not going to find that out today, what the answer is for that
No.
one. But
There's so many mysteries about costs of care because we can't shop when we go to ER.
Yeah.
And, like, how much is this going to cost? And the people there, they said to us, we can't tell you that. That's not our department. And so
You
it's
just go in
it's
and
a big
leave.
mystery,
Yeah.
and it's like a big hole in the
Yeah.
universe.
Probably the only thing, I don't know, maybe the only thing in the world that you do with you buy without really knowing the price of. You know, it's like
Right.
you know,
Well, I've
you
done
don't
that
have
a
any choice
couple
but
of
to buy
times,
it,
but-
but then you get the bill.
I think they're trying to address that some places in terms of an operation. You can find out specifically what it costs at different hospitals, but then who has
And they do
time to
encourage
do
you
that?
through your
And who
insurance
has
that-
the wherewithal to do that? I
Who
mean,
would
even
even
as I, as a
know?
doctor, if I had to have a surgery, I don't know how much time I would spend.
no,
Should I
no.
get this at this hospital, or this
No.
hospital, this hospital?
But the
Why
insurance
should we be
companies
doing
and
that as a
Medicare
patient?
are
We
encouraging
really
you to
shouldn't.
shop around.
Yeah,
Yeah.
but I mean, healthcare and medicine is such a complex, and the financial part of it is such a complex.
Well, I don't want to shop around unless I can bring my specialist with me.
All right.
That's
So,
the
and-
other thing. You know, I know the specialist. I know what he's good at. I know
Right.
what I want him to be able to do. And
Should we really have to shop for our medical
Right,
care?
right.
I mean,
No.
is that
I mean,
one of those
there's
things
other
that's a
worries you're
human
gonna be
right?
worrying
or-
about. You're worrying about your health. You
I
need to
just
then start
envisioned
to-
another PSA shopping for your Medicare or your health
Your
care.
health.
That could be fun to do that one.
It's a necessity of life.
Yeah.
It's like food, it's like water, it's like a roof over your house. I mean, if you're getting a car, I can understand. You can line up, okay, should I get this car, and where and where? And you can do that actually quite easily on the internet.
Yeah.
You can't for healthcare, and the question is, why should you? Right? Why can't we have a system where, you just say, I need this operation, I'm going to get it done at this place.
You know, we probably should talk a little bit about why you're all up in this area today.
Oh, good
I'm
idea.
going to be at a teach-in.
Okay.
Well, there's a teach-in going on. We're here because the healthcare movie is being shown on cable access TV, so we're
Okay.
here to let people know about that.
Okay.
Into film for our
Oh, you're
Yeah, and we're making
get
a
some
new film,
footage?
a
Good.
sequel to the healthcare movie, which
Good.
is
Yeah.
the working title is called "Now's the Time: Beyond Obamacare."
Okay.
Because the Obamacare or the Affordable Care Act came in, and it has helped some people. Some people are insured where they weren't before.
Yeah.
Some people do have coverage that they didn't have, and there's you don't have to worry about your pre-existing condition anymore. So there's
Yeah.
a number of things that are
There's some things
wonderful.
that are very good about
but
it.
at the same time, we still have the insurance companies between us and our health care. And so beyond that, there's
Yeah.
something even better.
Yeah.
So that's what our next film is going to.
And about
And-
what the advocates have been doing
Yeah.
in the last few years.
Yeah.
And we are going to put information about that teach-in at the end of the show. You can see what
Right,
that's all
yes.
about. We can put other information for you to make contact with some of our guests if they're willing to do that. And do we have more that we need to get out there? Do you think we're all set?
Well, I
Yeah.
just wanted to make one other
Oh,
comment
go
about
right- no, as much
democracy
as
in
you want.
healthcare.
Yeah.
This came up regarding Canada. They have a system, they call it Medicare, and it covers everyone.
Okay.
And the interesting thing is that because it covers everyone, if you're rich or if you're poor, you're in the same boat.
Yeah.
And so if there's something that you don't like about the system, like if they're saying they're not going to give you the equipment you need or something like that,
Right.
you're in the same boat as everybody else in the country.
It's
You
not
can
like
get
you
together
can't
with
get it, yeah.
them and you can say, "Hey, wait a minute. We're a voice for this." And your voice is heard because it's a unified voice. And so it actually is a democratic process there where if there is something wrong with the system, you can kind of self-adjust it as a group or as a country.
Yeah.
It's very eloquent. When you have a fractionalized system like we have now, the disenfranchised and the marginalized don't have a voice, and
No,
the
they
people
don't.
on Medicaid, their funding is cut much more quickly than other funding. So
Yeah.
if we're a collective, it does rise us all.
That really, I'm going to plug the next movie.
Oh,
if I
fine,
can.
fine, go
'Cause
ahead.
That really moves to the next movie because this is a much bigger issue than healthcare. And when we say beyond Obamacare, there's the other nuance to it, other than just healthcare, is that it's a bigger issue than healthcare.
Right.
And so our movie is going to kind of explore that. We think people kind of, when they think of improving their healthcare, they kind of go into this fog. They kind of get fogged over.
Yeah.
They don't know how, and so we're exploring that, and we're going to help people understand that, hopefully, a little bit in this next movie.
Well, a lot of people just don't even want to admit they're ever going to need it.
Yeah.
Yeah,
But-
that too.
Yeah.
But
But you
also
get
the
those catastrophic
misconceptions.
illnesses and then they're wiped out and go
Yeah.
file for bankruptcy.
Right.
There's so many different things that I can hear now that are working into this being profitable versus costly, because we'll eliminate so many
Yes.
different things that
It is
wouldn't have.
costly.
Yeah.
There's no question that it's costly, but does it have to be profitable for certain people?
No.
Yeah, that's
No.
a
Yeah.
good distinction. I
Yeah.
hadn't
Yeah.
thought about that before. Yeah.
Okay. I think we're going to wrap it up.
Okay.
I want to thank the three of you for being here. I really appreciate it. And you for coming up based on your 2 a.m. invite. You are awesome.
It's okay. It's an important subject.
Yeah, thank
Yeah.
you.
And good luck with the next film. I know it will be a success, and make sure you get on Access,
Yes.
because we can spread it farther. We don't have to worry about commercials or anything. That's the part that I like. If you're talking about something in your commercial and you mention a drug, we don't have to pay them, okay, for that exposure, and you have every right to mention it. So I like the freedom that you get. I like to constantly promote the free speech aspect of Access Television. That's
great.
why I got involved, a long time ago. So 28 years, I think, is when I
Wow.
first started.
Great.
Yeah, 82 was my first time hearing about it, and by 85 I was doing it. So,
Wow.
Great.
Wow.
yep, long time.
Great.
And now I get to have fun with it. So I'm glad that the three of you came to join us. I really do appreciate it. We will be putting information at the end of the show so that you'll be able to find the film. You can watch it online, and all of the other information that you need to know about the single-payer system. And don't be afraid of it. Thank you very much for watching, and don't forget to let me know if you'd want to have something specific discussed on the show. Sometimes we'll do that even if you won't come. We'll find somebody who will talk about your subject. So thank you again.